Erectile dysfunction, ED, is a common issue that can make it challenging to achieve or maintain an erection. While there are several medical treatments available, some people explore herbal remedies for managing ED. In today's video, we'll discuss 5 herbs and supplements that have been studied for their potential in treating ED, their risks, and how to use them safely. Let's dive in. What is erectile dysfunction? ED occurs when the process of achieving or maintaining an erection is disrupted. It can result from various factors, including stress, anxiety, medical conditions, or certain medications. While herbs might provide some relief, it's essential to approach them cautiously and consult a healthcare provider. 1. Red ginseng. Also known as Panax or Korean ginseng, red ginseng has been a staple of traditional Chinese medicine for centuries. It is believed to improve ED by boosting nitric oxide production, which enhances blood flow. Research insights. Studies suggest that red ginseng may increase testosterone levels and improve ED symptoms when combined with vitamin E. Risks. Possible side effects include insomnia, headaches, rapid heartbeat, and interactions with medications like antidepressants and statins. 2. Horny goat weed. Horny goat weed, or Epimedium sagittatum, is another traditional remedy known for its aphrodisiac properties. It contains icariin, a compound that may boost nitric oxide levels and support blood flow. Research insights. While animal studies show promise, there's limited evidence from human trials. Risks. Potential side effects include sweating, mood changes, and irregular heart rhythms. People with heart conditions should avoid this herb. 3. Maritime pine bark. Extracted from the bark of the Pinus pinister tree, maritime pine contains antioxidants called procyanidins, which may increase nitric oxide and improve erections. Research insights. Studies show positive effects on ED, but the research is still in its early stages. Risks. Side effects may include nausea, dizziness, hives, and potential interactions with blood sugar or clotting medications. 4. L-arginine. L-arginine is an amino acid rather than an herb, but it plays a crucial role in promoting nitric oxide production. This helps improve blood flow and supports erectile function. Research insights. Evidence suggests it may benefit ED when used alone or with other supplements, though larger studies are needed. Risks. Potential side effects include bloating, diarrhea, and kidney concerns with long-term use. 5. Yohimbe, derived from a tree native to Africa, contains yohimbine, which has gained attention as a potential ED treatment. Research insights. Yohimbine has shown mixed results, working better when combined with other treatments. Risks. Over-the-counter products vary in yohimbine content, making dosage unpredictable. Side effects include rapid heartbeat, high blood pressure, and severe risks like seizures or heart attacks. When to see a doctor. If you're considering herbal remedies for ED, consult a healthcare professional first. ED can result from underlying conditions like heart disease, diabetes, or certain medications. A doctor can help identify the cause and recommend appropriate treatments, including lifestyle changes or prescription medications. Safety tips for using herbal remedies. 1. Choose reputable brands. Look for third-party tested products to ensure quality and safety. 2. Monitor side effects. Stop use immediately if adverse reactions occur and report them to your doctor or the FDA. 3. Avoid unsafe ingredients. Be cautious of supplements with unlisted drugs like sildenafil, the active ingredient in Viagra. Final thoughts. Herbs like red ginseng, horny goatweed, and maritime pine bark may offer some benefits for ED, but they are not without risks. Always consult a healthcare provider before trying any alternative treatments. For many medical treatments or lifestyle changes, provide safer and more reliable results. Thanks for watching. If you found this video helpful, share it with someone who might benefit. Don't forget to subscribe for more health and wellness insights. Stay healthy, and we'll see you next time.